Professor Yusuf, first thing that I would like to say that you are doing a great job.
Thank you so much. Thank you so much. Thank you so much.
And number two, I want to thank Professor Ulemi to put me into this program.
Oh, mashallah, mashallah. I thank you and I thank Professor Olemi, both of you, actually.
And I just want to give you my brief introduction because it is
Yeah,
very interesting.
yes, please. Yes, please.
You quickly, very quickly, after finishing my MD in India, I came to Saudi Arabia in 1983.
Mashallah.
And then I had experience working in different disciplines.
Yeah, mashallah.
First in mental health hospital as a medical director for 18 years in Bureda Al Qasim region.
Yes.
Then I went to Netherlands to finish my PhD defense. Then I came back and I worked in Dubai, Rashid Hospital for 1 year.
Mashallah.
Then one of my friend, Dr. Abdul Hamid Al Habib, who is the director of National Center for Mental Health Promotion and Protection, he invited me to Saudi Arabia again.
Yeah.
And I worked with him about 20 years,
Mashallah, mashallah.
Within this period, Dr. Ulemi and we met in complementary and alternative medicine when this center was started by Professor Abdullah, who was the director at that time.
Mashallah, mashallah.
And Professor Ulemi was the training director, and Dr. Tamir Abu Shaban and two guys from Egypt, Dr. Ibrahim and Dr. Ghazafi. We wrote about 65 papers on complementary and alternative medicine.
Mashallah, mashallah.
And including one paper on myofascial pain syndrome Professor Marzouk has talked about.
Oh, mashallah.
Anyway, now without sir going into the complexities of World War I, World War II, and multiple times wars between Hamas and Israel, I just want to say few important messages rather than giving a more of a theoretical presentation. Now, the role of telemedicine or electronic health for mental health problem and physical health problems will be completely disabled. Will completely, if my slide is rotated quickly, it will be very nice, Professor Yusuf. So, telemedicine actually started with telecommunication, talking on the telephone. Then came the TVs, then came the dish, then came the mobiles, and somebody said from America, we will put everything into your hand and into your houses. Anyway, the most important implications of telemedicine is to provide medical, psychological, social, and spiritual help through communication with sufferers, war sufferers. Electricity is disabled, water is not available, medicine are not available. They are hungry, asking for the food, asking for everything they can have, They want shadow. And in war situations, sir, everything becomes inhuman. This this inhuman behavior not only perpetrated by defense forces of both sides, but what are the faults of innocent people living there? It is internationally not acceptable at all to bombard a hospital. It is not acceptable to bombard the population of their no faults. This is human crime, sir. And we are watching this on social media, the high degree of criminal, the implication of such wars and the importance of telemedicine is that if mobiles are not disabled in circumstances like Hamas and Israel war, people can communicate with each other. And as of Professor Ulemi and Professor Alim and Professor Marzouk and Professor Zara told us about how to use the alternative and complementary medicine in such crisis, human crisis. I think that is very, very great. I don't want to repeat all those kind of things, from herbal medicine to other homeopathic medicine to osteopathy and to physical therapies and hijama and cupping therapy, which are same. And what I want to say that everything is possible through telemedicine if war is not of that dimension which disabled everything. Water supply, electric supply, food supply, supply chains, all kind of things are closed for the people who are engaged in the war. And who are not engaged in the war at all, they are the worst sufferers in such circumstances. Thank you very much, sir. Again, the topic is about telemedicine in wars or medicine under siege situations. Wallahi, the condition of wars are very difficult. Very, very difficult. Everything is disabled. Everything is disabled completely. When there is a war, especially between Hamas and Israel. How to move the slide? The benefits to healthcare professionals as far as telemedicine is concerned: improved diagnosis and better treatment management, continuing education and training, quick and timely follow-up of discharged patients, access to computerized comprehensive data about patients, both offline and real time. Next slide, please. Types of technology: store and forward, and two-way interactive television like we have now, Zoom meetings. And the impact of telemedication to speed up the communication between the patient and the caregivers and the healthcare providers. The patient have quick access to specialized healthcare services to underserved rural, semi-urban, and remote areas. Now, in particular relation to the war, if the communication channels are open and accessible, everything is possible through the telemedication. And it will help in early diagnosis about the injuries, about the physical condition and mental health problems. These are already discussed by various previous eminent presenters. Access to expertise of medical specialties, super specialties, and different type of medical specialties, including the complementary and alternative medicine. And telemedicine also helps in reducing the physician's fees and cost of medicines. It also reduces the visit to the specialty hospitals or super specialty hospitals. Reduced travel expenses, early detection of disease, and reduced burden of morbidity and mortality. So, overall, the benefits of e-health or telemedicine are vast in numbers, and that helps to utilize it by poor people as well, or poor patients as well. Next slide, please. Dr. J. Sanders' first setup of telemedicine, Boston Logan Airport to Massachusetts General Hospital in 1967. A very intellectual person. Definition by World Health Organization: delivery of healthcare services where distance is a critical factor. Distance is a critical factor by all healthcare professionals using information, using relevant and specific information and communication technology, that is, of course, e-health, for exchange of valid information for diagnosing, treating, and prevention of diseases and injuries, helping in research and research evaluation, and for continuing education of healthcare providers, including doctors, nurses, psychologists, counselors, and spiritualists. In the interest of advancing the health, advancing, protecting in and prevention of diseases of individuals and their communities. Next slide, please. Telemedicine and ways of communication. Three main communication. Point two, mutual point between patient and the doctors. One patient connected to one doctor within the same hospital. One patient and at a time connected to many specialist doctors. Point two, multi-points within the same hospital. Then several patients and connected to several different specialist doctors. multiple points to multiple points. Next slide, please. This is a diagram explaining application of telemedicine softwares, virtual monitoring, hyper specialty care, chronic diseases and management. Of course, when talk about chronic disease and management, it includes both physical and mental health problems, already discussed in detail by eminent professors. Ambulance treatment during transportation of the patient. Medication management and disaster relief. Now, regarding the disaster relief, regarding the disaster reliefs, it is particularly relevant to the wars, occupations, next slide, please. Types of telemedicine, 3 different types. Interactive telemedicine, where the patient can interact with the professionals, healthcare providers. Remote monitoring at the level of villages, where there are no facilities, telemedicine help a lot in monitoring and providing the medications. Store and forward telemedicine. This is the third type, Next slide, please. What are the benefits of telemedicine or e-health for patients? Whether the patients are in war zones or otherwise. Lower cost that I already talked about. Enhance preventive care. Like, for example, in COVID-19, for example, we were prescribing prescription to online prescription to the patient consulting us online. Improve access to care, reduce the spread of infections, very important point, and provide convenience to patients who are especially in remote areas and do not have access to the hospitals. In the recent past, sir, telemedicine has been recognized as a game changer in the field of healthcare, providing a new way for patients and healthcare providers to communicate with each other excellently and explicitly and understand each other as far as the disease is concerned, treatment is concerned, and outcome is concerned. Telemedicine bridges the gap in mental and behavior healthcare. If somebody provide me with a WhatsApp message and upload, for example, MRI and CT scan or something like that, I can make the diagnosis very quickly, whether it is physical disease or psychiatric problem. If there is a photo of, for example, an epileptic patient and came to me on my WhatsApp or my mobile, I can make the diagnosis very quickly. Telepsychiatry is a way to address the shortage of mental health specialists. Here is a problem, Worldwide, as far as my knowledge is concerned, I think mental health specialist or mental health professional, or what we call to reduce the stigma, behavioral health professionals are in a very, I should say, the patient and the mental health specialist ratio is very wider. Mental health specialists are reduced in number as compared to the patient population. To benefit from the telemedicine applications and websites to meet behavior and mental health needs, e-medicine health tech, a leading telemedicine app development company. This is the company where most of the application of telemedicines are produced. Reduce the stigma. These are some of the telemedicine patients are closed in a classroom and everybody is busy with the lecture from remote place. And these are some of the paramedical staff who wait for hours if the telemedicine is not around. Next one, please. Here my own summary written by me. Hamas and Israel war is an example of medicine under siege. And the title or subtitle suggested or selected by Professor Yusuf and his excellent team is to the point, and I appreciated it very well, and I immediately accepted the invitation to speak about this topic. Thank you, Professor Yusuf.
Thank you.